before I start, I just want to just look on video first, and then.
Now, if you look at the conventional medicine is all about symptomatic treatment. So, if you go to the doctor and then say you have a fever, you have a joint ache, you have a cold, flu, as for the symptoms, they give you the medicines. But Ayurveda doesn't work like that. Ayurveda basically works from the root causes. It finds out what exactly is going in the system, and from that point of view, we work to eradicate that specific root cause. And that's why it generally never comes back. So Ayurveda, as everyone knows, which is a very simple thing made from two words, Ayur and Veda, which is science of life, and found more than 6,000 years back. Very ancient science. Each and everything what it says in Ayurveda, it will stay there for many, many millions of years, because it has been written that way. And even though you are in a modern age, if you apply the same rules, regulations, and whatever it says in that Ayurveda book, you can make your life much healthier.
So first of all, I would like to thank everyone to come this evening, and today what we started is not just a GI wellness clinic, it's like a movement. And I want all of you to be a part of this. My story started in 1992 when I was 12 years old, and my father was diagnosed with a liver cirrhosis. We went to so many doctors, the conventional doctors, and the doctor said your father has 6 months to live. At that point, as a family, we just completely broken because we didn't know any light at what's basically going on. And in that process, we found in a very small place in India, of one old man practicing some herbal medicine. Every Saturday and Sunday, outside his house, almost 500 to 600 people queuing. And I was just thinking that what he's doing something different than the doctors, that more people are queuing outside his house. We started with some of the reference. We took my father to him, and he put my father, after all the medical diagnostics, when the doctor said we cannot help you, he put him on specific herbs. And today my father is 72 and healthy. So that's where kind of a journey started. Then I became a medical doctor, did my internal medicine, MD, London. Then I decided, I've seen a lot of, as a residential doctor, working in a St. Thomas's and Newham Hospital and a lot of other places in London. And I saw that nobody's getting cured. Everyone is just coming to see the conventional doctor, get the pill, get the prescription, go home, and the one word they always the doctor use is go and manage your condition. So I was just thinking, like, if you really need to manage your condition, why don't you manage with some natural stuff? Why with some aggressive chemical pills, which is never-ending story? And if you know around you people who are going through conditions, problems, like immunosuppressive conditions or aggressive conditions, they never come out from that. They start with maybe say 2, 3, 5 tablets, ending with 20 tablets a day. So that's what my vision is. My vision was, yes, I'm a medical doctor, but I want to do something. And the first thing I started, I established the first clinic in London where I was diagnosing the patients with the medical diagnostics, but treating with herbs. So I did my PhD in Ayurveda, which is I just told about in that video, which is the Indian traditional medicine. And this is world famous. You can find the plants in Holland, Germany, India, and it's global. And a lot of people know about this, yoga and Ayurveda, it's huge. So everyone knows that doctors are helping with the symptoms, and I wanted to change that. And I found out that many people in this room, I'm sure you guys are also Google your symptoms many times in a day and find out what condition you're going through. Because out there is Instagram and Facebook, colleges are there, which provides the great knowledge. But I believe that going to a professional qualified person can exactly find out what exactly is going in your system. And I picked up the best of everything to create this model. So in this journey I met Ernie, where he provided me the gastric capsule endoscopy. Then we met Paul for microbiome. We are doing biomarkers. And after doing the proper diagnostics, I thought I come in the picture and I design individually personalized nutritional plan for everyone. Because the food is everything. What you eat, what you are. So in the whole process of this treating the conditions, I designed the specific diet plans, give them herbal supplements. The whole idea is to see how you are greatly helping your system rather than just jumping from one to another alternate. That's not the right way to do it. Now, when I tell people that this is not good for you, and if you stop this for a while, you can see the change. I have given a couple of examples today. Like I got a patient who was suffering from acid reflux for more than 6 years, and I just told him very simple thing: stop the gluten, stop the wheat. And he did it for only a month, and 3 years now, no acid.
Wow.
So there are the simple changes you can bring in your life and you can get better. You should know what is going in your system. You should know that what kind of food is it for or a friend to your system. By doing that, you can help many. And I've seen thousands of patients in London, Brazil. I got clinic in India, Toronto, everywhere. The simple thing I tell them, which they come to my clinic, I put them on a specific program, and after 3 months they come back as a new person and say, Dr. Oh, this is great. Is it that simple? We didn't know. And I said, yes, it's very simple. Because human brain designed to change habits every 63 days. If you put on a specific habit, you can change that. So it's not important that you have to eat red meat. It's not important that you have to enjoy your alcohol or a caffeine or ultra-processed food. No. If you find out that specific things are not helping you, you can stop that, and it's very easy. But to go on that first step, people are scared of, and that's where I come in the picture. To take them with my, holding their hand on this journey. So the whole idea to open this first flagship clinic is to model this, in the different parts of the world, especially in America as well, is to bringing the awareness, because that's what not people don't have that. It's just about, as I just said, Instagram and Facebook, and they just go through different funny videos. And it's so funny. Other day I got a patient and said, oh, I saw this video, Dr. Rohan, and they said I can eat 3 times a day raw salads, which is great for me. And I said, what happened? He said, I love the salad. I ate 3 times a day, but it gave me so much gas. And my stomach looks like a pregnant woman. So I said, thank you. Where did you find this? They said, oh, this is from video from the Instagram. I said, very good. Did you find out who was talking about that? I don't know, but some guy, like, he's kind of a model for all the youngsters. I said, very good. so he knows how to tell us that. So these are the misinterpretations and myths, like people do not understand about the body. And once you go to the qualified person, then you can understand what kind of path you should take. So I'm thanking all of you here to come here and listen to this, the whole thing. But I also want to welcome you guys. Come and experience this whole thing, what we are presenting here. Because this is, again, guarantee that this is going to change your life for better. You will never see yourself so healthy and happy from inside. That I can guarantee. Because outside everyone can put the K-beauty and makeups, right? Which is all about is inside. And that's where I am here to help you. So thank you very much for being here, and I'm going to introduce great Rick, who does the peptides.